HealthySimulation.com Simterviews. What needs to happen for simulation to move to the next level of utilization?
I think that some advocacy work in terms of lawmakers, in terms of third-party payers, meaning insurance companies, in terms of regulatory and accrediting bodies like the Centers for Medicare and Medicaid Services, the Joint Commission, and educating as to how we can use simulation as a more powerful force for creating higher quality healthcare and safer healthcare would help. And because they could turn up the heat a little bit on terms of some regulations, perhaps some legislation, and or just general encouragement for hospitals and healthcare system to increase their use of simulation.
I think there's two things. I think one of them is still affordability, although we've made huge strides in that over the years. I mean, as I mentioned, our first simulator was $250,000, and now you can get, perfectly acceptable models for $30,000. But low-income places still can't afford that. Generally speaking, the technology has not been hard to get. What is almost impossible to get is the education and training to help people be good at teaching with this equipment. And so I think in order to move forward, people need to be just continually educated in how best to use it.
We realized that many centers are doing a lot of creative things, and they're doing so much work that they haven't been able to publish yet. So we have presidents of the societies, journal editors, and other kind of leaders in simulation brought together to put a large-scale survey to figure out what are all of the creative things that people are doing in a way that we can inform the field of where the research needs to be so that we can build on what we know and keep building and creating, and also what kind of resources educators need as they enter this online learning environment and they are trying to figure out how to best offer their education. We're hoping to provide that information to them.
From the traditional sense, right? So from the face-to-face things, they establish simulation-based training programs like, from a proceduralist standpoint, central line training. Lots of studies, it works, it reduces infections, it reduces complications, or code team training, or the rapid response training where it improves teamwork and communication, adherence to protocol, and many of those other types of training that we've proven over the last 10 or 20 years that it saves lives, reduces errors, reduces infection rates. Everybody should be doing it in all the hospitals and institutions, but it still is not, right? And so I think for those types of programs, the hospital systems, hospitals, insurance companies, governments really need to understand the value of it and really set that as an expectation.
We all have to continue being creative. I think that the tools have to be easy to use. They have to be intuitive, and they really have to embrace a more open architecture where you're not as dependent on a specific device, a specific manufacturer, so that there's more open sharing of learning outcomes and the basic concepts around those learning outcomes, so that we can let the analysis and the data and the outcomes guide technology development. It's how do we collaborate together and build the products that make a difference. And that doesn't happen in a silo.